Yale Pediatrics has a long and storied history of excellence and really making great discoveries and treating children and being innovative. I was really looking and say, okay, I've got X number of years left in my career. How am I going to have the biggest impact for children? And I really felt that at that point, having the opportunity to lead a department and to be a leader in the hospital and affect many lives, both patients and trainees and families, I thought that was more impact. The good news is the children are incredibly resilient, that it's really a very rewarding field because children bounce back from things that adults never would. One of the lessons I've learned over 30 years of practice is to listen to the families. They have an intuition. They know their child much better than anyone else. And so they know when they're sick. They know when there's a problem. And then how do we translate that into trying to figure out what's wrong? Children often can't tell you what's wrong with them, and they only know what they're experiencing, and many of them can't even talk. And so you have to be able to use a lot of different cues and clues to really figure out what's going on. And so to me, that's always been a fun and exciting challenge.